Hello, welcome to Special. My name is Anastasiya Lavrina, and now I'm joined by Dr. Tedros Adhanom Ghebreyesus, who is WHO Director General. Warm welcome. Dr. Tedros, thank you so much for your time. Thank you for joining us here.
Thank you for having me.
Indeed, it's a great honor for us to host you on AnewZ. And let me start with a very, very important question, not only for me, but for all our viewers and for, I guess, many people around the world. 6 years after the COVID-19 pandemic, many experts still say the world not adequately prepared for the next global health emergency. So what concrete changes have been implemented since 2020 that make the world safer today?
No, thank you. That's a very important question. As you rightly said, many people ask, and they ask me whether we're prepared or not. And my short answer is yes and no. And I will tell you why it's a yes and no. First, it's yes, because based on COVID lessons, we documented what has worked and what hasn't worked, meaning we learned our lessons from COVID. And after documenting those lessons, we have started already several initiatives to address the weaknesses that were documented or the challenges that were documented. And these are, for instance, when we had COVID, we didn't have an international law to govern the whole response. And that's why we have now a pandemic agreement. And it was agreed last May, as you remember. Of course, the PAB's annex is being negotiated, and we hope that will also be agreed. I think that's the framework that will prepare the world for a better response in the future. And then, of course, there are other initiatives we have started. For instance, the biohub. One of the challenges was sharing of samples from countries was a challenge. And we have a biohub that can facilitate sharing of samples. And of course, surveillance weaknesses were also documented. And that's why we have the pandemic hub, pandemic intelligence hub, that is now using, including AI, to detect any case as early as possible. And of course, especially to have a strong response at the country level, the national capacity is very important, because it's when there is a strong national capacity that we can all be safe, because as you know, we're as strong as the weakest link. So for that, we have established the pandemic fund together with the World Bank, supported by member states. And the pandemic fund is already supporting more than 70 countries to build their capacity at national level. So I can give you other things, also a long list, but that's why I say it's yes, because we're implementing several initiatives based on lessons learned from COVID. On the no side, we're still not prepared, because these things are only starting. So we need to implement all of them. And those we have started implementing are at an early stage. So we need continued implementation, and we need continued investment. We're still vulnerable to some of the weaknesses that we had in the past. So the world should not forget the investment in epidemic preparedness and response, or in health security, because still the vulnerability is there. Absolutely.
I guess you will agree with me that no any country was ready for pandemic COVID-19 at that time. That's why so many reforms are being implemented now to have this, let's say, unique approach to this problem in case it happen again. But one of the biggest challenges the countries faced that time was the I will say, even it's sometimes was called as a vaccine nationalism, when some countries prefer to nationalize a huge amount, to purchase a huge amount of vaccines, and when they were also the countries, the poor countries, who could not afford enough vaccines for their population. Therefore, how confident are you today that the international system will distribute vaccines more fairly in the next pandemic?
Mm-hmm. And I agree with you. One of the major challenges was lack of equitable distribution of vaccines during COVID. And as you may remember, WHO has been proposing to the world to support, especially countries in the developing world, to have access to vaccines. But that was a big challenge. Now, one of the lessons learned is actually that, and how do we address it? And that's why one of the lessons now is to improve local production. For instance, we have mRNA transfer technology hub in South Africa, in Cape Town, which is helping 15 countries. And that hub will strengthen local production in as many countries as possible, because it's with the improvement in local production that we can have a lasting solution. And at the same time, the other important progress we have is the pandemic agreement. In the pandemic agreement, in principle, member states have agreed to set aside 20% of the production for, to support countries who don't have the capacity. So that's, I think, a very important development. And that's why I said, we're better prepared now, because at least there is this set aside 20%. Regulations. Of course. And I hope with the ratification of the pandemic agreement, if this is implemented, so we're addressing one of the problems we have seen and documented during COVID, and another lesson learned.
That time, the World Health Organization has often faced accusations of political pressure from some countries, from powerful member states. How do you ensure the organization's decisions remain scientifically driven rather than influenced by the geopolitical pressure by those who have more global power and influence?
So the first thing is, and then, the organization should protect science. And whatever we say should be based on science and science. Because, if we derail from science, that will actually undermine the trust on WHO. So as you might know, in the last few years, whenever a pressure comes from one corner, this corner or that corner, we always refuse to succumb to the pressure and stay, or keep our position based on science. So the organization, whatever pressure comes and whatever repercussion it may have, even when it comes from powerful countries, it's happening now, it should make a choice of saying no and say things based on science and science only. So that's key, because unless there is a commitment from the organization to protect science, it could be difficult. So we shouldn't take sides with this country or that country. We shouldn't succumb to pressure from this country or that country that protects science. And whatever we say and whatever we do should be based on science. So it's that mindset which is very important. It may have repercussion, but we have to face the repercussion. That means if we do it based on science, we're not doing things, it means we're not doing things based on fear or favor. We're doing things based on science, and that should be the central issue. So it's respecting the value of the organization, which is number one. And the value of the organization, which is science, should not be replaced by money or anything, any pressure. That's a principal issue. But for the organization, though, to be as strong as possible, as independent as possible, the financing model is important. Meaning the organization should have financial independence, meaning the money should not come from few that may try to dictate, but the money that WHO gets should come from all member states, 194. That means it can prevent shocks if any big donor withdraws, and at the same time, it ensures independence. So that's why in 2017-18, as soon as I became Director General, we identified reliance on few donors, on few major donors, as a risk for the organization, a major risk actually. And that's why we have decided then to broaden the donor base, meaning to increase the contribution of all member states, meaning what we say the assessed contribution or the membership fee. Countries, we have 194 members. We asked them to increase their membership fee. When we started the reform, from the total budget we have, the assessed contribution or the membership fee was only 14%, 14%. And that's not good, because most of it is coming as voluntary from big donors, and it comes with influence. So in order to say no when we have to say that, we need to have flexible funding and broader that comes from all. So our member states agreed at that time, understanding our argument, to increase their membership fee from 14% to 50%, and to pay it over several installments, of course 5 installments. They have done already 2 in 2023 and May 2025, just last year, the second one. And we expect the third one in May 2027. And then, of course, the remaining will be May 2029, May 2031. By then, WHO will have stability, and that will contribute towards independence.
Yes, indeed. Pandemic COVID-2019 required a lot of attention and still on the agenda to manage the future possible crisis and the responsibility of each and all member state and the organization itself. But beyond the pandemics, the WHO warns of rising threats like the climate-related health crisis and some other issues. Which of these do you believe poses the greatest risk to global stability over the next decade?
It's very difficult to choose this or that, but maybe apart from the health issues, whether it's climate and health or AMR, if there is one thing that worries me, the biggest concern I have, especially now with the crisis unfolding in our world, is actually conflict. It could have a major impact on health. The current war especially, and the shelling or bombardment of nuclear facilities could have significant damage on health, not only in the countries, Iran and the neighborhood, but even beyond. So that worries me a lot, more than even the climate crisis and AMR. And you have also seen recently several refinery facilities were shelled or attacked in many countries in the Gulf and also in Iran. And that also is a reason for concern, because it can have immediate impact in air pollution, especially children and the elderly are the most affected. So I just wanted to say the current war, it's a very dangerous one. And if it continues, and God forbid, it may trigger even bigger war, that could have a serious repercussion on health.
Especially taking into account the number of IDPs and refugees.
Exactly, the displacement, there's everything. So that's what worries me most. And then, of course, the climate crisis, there is climate and health, there is AMR. These are equally very important issues. My message is we have to invest in both. It's not either or. These are significant challenges. For instance, if you take climate change, we're already seeing it. It's not theoretical. It's not about will happen in the future. It's happening now. For instance, in many countries, asthma in children is on the increase. Non-communicable diseases, cardiovascular disease in the increase because of climate change. And malaria and dengue on the increase. Infectious diseases are also on the increase. And we see even we're detecting malaria and dengue in areas that have not been common in the past. So, the climate crisis is a health crisis. That's why we call it that way, because we're already seeing.
Huge, significant work you are doing. That's why, Mr. Director General, thank you so much for your time. Thank you for joining AnewZ today. It was a real pleasure and honor for us to host you.
And thank you. And Azerbaijan is a strong support to WHO. We work closely and we get support starting from His Excellency, the President, and we really appreciate that. It's the support like Azerbaijan's that keeps us, working and seeing the fruits that inspires all of us. So thank you. Thank you so much for having me.
Thank you very much, and we also hope that this 13th Global Baku Forum will serve as a great platform to discuss, to negotiate the future potential projects which will definitely benefit the WHO and each and all member state of this organization.
That's exactly a very important point, by the way, with what's unfolding in this region. Of course, Azerbaijan is close, is, as I said earlier, very concerning, and also the damage which is happening, heartbreaking. And the Baku Forum is a very important forum to discuss current issues and propose solutions, because war is not the answer. There should be a political solution, and it's dialogue like what we're doing in Baku, which is important. Anything can be resolved through dialogue. And as we always say, peace is the best medicine. And I would like to use this opportunity to thank NGIC, especially my friend Rovshan, the Secretary General of NGIC, for this excellent forum and showing the way. Dialogue is the way. And I hope our world will come back to its senses and believe in dialogue and resolve issues peacefully. And I was very happy to hear the President say yesterday, you know, our relationship with Armenia has improved, and resolving our issues through peaceful means. Although what we say is lasting peace, but he said what we want is peace forever. I want to quote him for that. And that's what we need, peace forever, and peace is the best medicine.
It's very important to listen from the participants and from the guests when they are expressing their willingness to see the peaceful development in the region of the South Caucasus, which will definitely benefit not only two countries, Azerbaijan and Armenia, but also the region itself.
Exactly, and beyond.
Absolutely.
And I hope the world will learn lessons from this through dialogue, resolve long-standing problems, and move on, but not lasting peace, as the President said, peace forever. That's what humanity needs.
Yes.
Thank you.
Director General, once again, thank you so much for joining our program today. Hope to see you again in Baku.
Thank you.
Thank you.
Thank you for having me.